hemoparasites, means parasites that are found in the blood. The first disease, that is the malaria. Okay, malaria, it is caused by the parasite Plasmodium, and the Plasmodium, it has mainly 4 species. The important one is the vivax and the falciparum. In India, we see the vivax and falciparum. Here in Kerala, vivax is more common, but in northern parts of our country, there is falciparum malaria. But now we know there are plenty of northern Indian residents also in our state. So now we are also seeing plenty of falciparum cases also. This Plasmodium vivax malaria, it is a mild form of the disease, whereas falciparum, that is very dangerous, we can lose the patient. So how is malaria transmitted? This malaria, it is transmitted by the bite of the infected female Anopheles mosquito. You should study the name of the mosquito, that is female Anopheles mosquito, which transmits malaria. Then a brief discussion about the life cycle. So this, we are seeing an Anopheles mosquito here. She is biting, okay, and through her mouth, the sporozoid, that is a specific form of our Plasmodium. This Plasmodium sporocytes, they are entering the body, and through the capillaries they go to the liver. Within the liver they multiply, okay, and this form is known as a merozoite. This merozoite form, that is released from the liver, and this merozoite, they go and infect the RBC, and within the RBC they undergo an asexual reproductive cycle and later develop into gametocyte. Okay, both male and female gametocyte may be produced, and when another mosquito comes, this gametocyte is taken by this mosquito, and within the mosquito the sexual cycle takes place and the gametocytes fuse together to form the sporocyte. So that is the life cycle of the Plasmodium malarial parasite. Once again, that is a merozoite. The merozoite form, that is the form which is produced within the liver. This merozoite forms, they are the ones which are infecting the RBC. And within the RBC, there are 3 stages. Okay, that is the trophozoite stage, schizone stage, and a merozoite stage, that is already we discussed. This is the peripheral smear, as we told, as we have already discussed, it is a hemoparasite, and we are seeing the peripheral smear of the patient. These are the normal RBC. Okay, so what about these? What are these structures? So the red arrow points to an RBC where we are seeing ring-like structures within the RBC. That is the ring form of the parasite. Okay, and the blue arrow, that shows another form, that is the trophozoite or the schizone form of the parasite. This is how malarial parasites looks like in the peripheral smear. So as we have discussed, the falciparum malaria. That is very dangerous. Why? Because falciparum infection, it will produce fatal complications. One is the cerebral malaria. That is, it can directly involve the brain. Okay. And there can be hyperpyrexia, means very high degree of temperature that cannot be controlled. The patient can go into shock. That is called an algid malaria. And the last one is a black water fever. What is a black water fever? Here, plenty of RBCs are infected together. So what happens? This infected RBCs, they are all gets destroyed together, and massive amount of hemoglobin will be released from this RBC. This hemoglobin is toxic to the kidney, right? And there will be dark colored blackish urine. That is called a black water fever. How to diagnose malarial infection? The most important and the most simple technique is a blood film examination. The next one, that is a QBC. A QBC means a quantitative Buffy coat. You know Buffy coat? That is when we do the PCV test. Okay, when we do the PCV test, we get a layer which contains the WBCs and the platelets. Okay, and just beneath that layer, we will get the RBCs that are laden with this parasite. So we can look at that area to see the parasite. And next is the rapid diagnostic test. Means there are kits. There is diagnostic kit. When we apply a drop of blood, that will give a positive or negative result then and there itself. And also by PCR. So this is a smear. This is the thin smear. Okay. And this is a thick smear. Both thin and thick smear can be taken to diagnose the malarial parasite. Then there is a relapse. Relapse means a person, he had an infection of malaria, he was treated and he remained asymptomatic for a few months of time, and after that he is getting a second attack. That is known as a relapse. It is caused due to the parasite remaining in a dormant stage within the liver of the patient. Okay, and after some time they get reactivated and again produces malaria. This dormant parasite, they are called hypnozoite, and this relapse is seen with vivax and ovale infection. So that finishes malaria. Now coming to the last topic, that is filariasis. This filariasis, it is also caused by protozoan parasite. Mainly there are two species, that is the Brugia malai or the Wuchereria bancrofti, and it is also spread by mosquitoes, and this is the Culex mosquito. Malaria was spread by the female Anopheles mosquito, and the Culex mosquito, it spreads the filariasis. So this is a picture of a microfilaria. Microfilaria, it is the larval form of the filarial worm. The adult worm, it lives in the lymphatics, or it lives within the tissue, right? And when this adult worm, it becomes mature, it will start laying eggs. And these eggs hatch to produce the larvae. And what do these larvae do? This larval form is found in the blood. And when another Culex mosquito bites, this larval form will enter their body also. So this larval form of the filarial worm, that is known as the microfilaria. Okay, so we are seeing, so this is the worm, microfilaria, that is seen in the peripheral blood. It is very large. Okay, the other small structures that you see, that is the WBCs, neutrophils, can be seen. This is a picture of the adult worm. An adult worm, it is not seen in the peripheral smear. Remember, only microfilaria can be seen in the peripheral smear. Adult worm lives in the tissue within the lymphatics. So, coming to the life cycle of the parasite, the mosquito is biting here, and the microfilaria will enter the tissue, and within the tissue it develops into an adult. This adult worm, it produces microfilaria that goes into the blood, and from this blood it enters another mosquito, right? So what happens to the patient when we have a filarial disease? Remember, where does the adult worm reside? Within the tissues. So when the adult worm resides within the tissues, it is blocking the lymphatic supply to that area. Suppose the inguinal lymph nodes. Suppose there is an adult worm that is living in the inguinal lymph node. The lymphatic drainage of the legs, they finally reach the lymph node. So this worm, that is blocking the lymphatic drainage. So what happens? All the lymphatic vessels of that particular leg, it will get enlarged. So it gets enlarged and swollen, and there is lymph gets accumulated within the limb. So that is known as a lymphedema, right? And when there is persistent long-lasting lymphedema, there is a skin reaction also. The skin will become very rough, very thickened and fibrotic. So this edema of the lower limb together with this skin change, they are together known as elephantiasis. Okay, mand, kaalile mand, that is elephantiasis. And also remember, not only the leg, other areas like scrotum, penis or vulva can also be affected. And the person will also have eosinophilia. Eosinophilia means there is an increased number of circulating eosinophils in the blood, right? And in some persons, there can be lung involvement also. They have symptoms of asthma, chronic cough, which is associated with eosinophilia. So that is known as a tropical pulmonary eosinophilia. So that finishes our class. So we have dealt with typhoid, leprosy, polio, hepatitis, malaria and filaria. So everyone prepare notes, take your time, study well. Okay, all the best. Thank you.